I have the A32 amendment.
Senator Pappas offers the A32 amendment. The Secretary will report the amendment.
Senator Pappas moves to amend Senate File Number 1098 as follows, page 62, line 12, delete. This is the A32 amendment.
We'll make sure the amendment gets distributed to everybody. To the amendment while it's getting distributed, Senator Pappas.
Thank you, Mr. President. This amendment would require that each business currently limited in capacity by an executive order offers their employees paid time off for illness in order to reopen at full capacity. Members, our number one concern should always be the health and safety of Minnesota families. The best path to getting people back to work is to limit the spread of the virus and for people to get vaccinated. Recklessly reopening businesses risks increasing workplace and community spread, moving us backwards at a time when new, more contagious variants have emerged. An important way to prevent workplace and community spread of COVID-19 is to protect workers on the job by ensuring that they have a voice in determining what is safe, the equipment, experience, and job protections to help them to ensure their own safety, and the financial ability to stay home when they or their loved ones need to quarantine. Members, Black and Latinx workers in Minnesota are less likely to have access to earned sick and safe time. 64% of the state has earned sick and safe time, but only 58% and 48% of Black and Latinx workers have ESST or paid leave, respectively. Part-time workers, those working less than 35 hours per week, are 45% less likely than full-time workers to have ESST. The workers in our state who are least likely to have access to earned sick and safe time are the very workers preparing and serving our food. Only 25% of food service workers have access to earned sick leave. No one should have to choose between quarantine after a COVID exposure or caring for a sick loved one and paying the bills. When people get sick, they should be able to stay home, not just for their own health or that of a loved one, but for the health of all of us. Unfortunately, those workers least likely to have access to paid sick time work in the very service jobs affected by the reopening provisions in this bill. Businesses that offer paid sick time report that it's good for business, resulting in fewer workers coming to work sick, higher productivity, and lower healthcare costs through better use of preventive care. If we truly want to get people back to work, then all workers must be able to afford to stay home and avoid spreading the virus by ensuring that especially workers in the businesses proposed to reopen by this bill will have access to paid leave. With that, Mr. President, I urge the support of the A32 amendment. Thank you.